Crisis sa bansa at ang mga hakbang na ginagawa ng pamahalaan laban sa pandemya. Mula sa Pangulo ng Republika ng Pilipinas, Mayor Rodrigo Roa Duterte. Ito ang Talk to the People on COVID-19.
This will be a long night. Ikaw na lang ang moderator.
Yes, sir.
Since you know the personalities who will talk here under expertise, ikaw may alam.
Yes, sir.
I'll give the baton to you to
Thank you, sir.
orchestrate tonight's discussion.
Okay, sir. Maraming salamat po, Mr. President. We have the panel of experts, and we can begin with Dr. Edsel Salvania to make his presentation with the clinical features of the Delta variant. We can, with your permission, sir, we would like to acknowledge Dr. Salvania to make his presentation. You have the floor, Dr. Salvania.
Thank you, Mr. Chair. Good evening, Mr. President. Good evening to the Cabinet and members of the IATF. May I have the slides up, please? Okay, Mr. President, this is actually an update of what I presented to you before about itong nakakatakot po natin na Delta variant. We know more about it now, and what we are seeing is continuing to be scary. We call Delta the fastest and the fittest virus po na na-produce ng COVID-19. It is 60% more transmissible than Alpha, yung UK variant, which is already 60% more transmissible than the original virus. It is 3 times more contagious than the original SARS-CoV-2 virus. It also seems to be deadlier, and this will be worse if the healthcare system is overwhelmed. Patients also seem to get sicker, and younger ages can also develop severe disease po, Mr. President. Next slide, please. So ito po yung nakakatakot sa Delta kasi alam natin the original virus from Wuhan, it can infect about 2.4 to 2.6 people. Yung sa Europe 3, yung Alpha na UK variant, it can infect 4 to 5. Itong Delta, up to 8 people po pwede niyang i-infect. And those 8 can each infect another 8. Kaya nakikita po natin yung sa India, nakikita natin sa Indonesia. Ang bilis-bilis po talaga ng spread. Exponential po talaga ang spread. Next slide, please. So, ang nakita po, there was an outbreak in China. And we know naman China has a very good healthcare system. Nagkaroon pa rin sila ng outbreak of about 168 people, pero mukhang na-contain naman po nila. But what they found was yung Delta has 1,000 times more virus particles than the original virus. Kaya ang nakakahawa po talaga, there's also a longer duration of infectiousness. There is also a faster time from becoming infectious from the time you're exposed. Dati it takes about 3 days bago ka nakakahawa ng mga tao. Ngayon, mga 30 hours lang pwede nang makahawa. And of course, there's a lot of virus. So even asymptomatic pa lang, nakakahawa na po. And yung sinasabi natin dati na close contact na at least 15 minutes, that is really out of, nakita po nila even in Australia and in China. Minsan 1-2 minutes lang pwede na pong mahawa. So this is a very contagious virus po. Next slide, please. So in summary po, we know Delta is more transmissible, it's potentially deadlier, and can spread quickly faster. But it is beatable with our minimum health standards, face shield, face mask, physical distancing, and of course we have to vaccinate everyone. We just really need to make sure na mag-level up rin po yung ating compliance because the virus has really leveled up. The treatment remains the same. Deaths are going down in countries with high vaccination rates. So tama po yung ginagawa natin. Continue to vaccinate. We were more cautious with relaxing our measures. Yung sa US, nagtanggal na sila ng mask. Even though mataas yung vaccination rates nila, that was the wrong thing to do. Lalo na with Delta kasi pwede pang mahawa. So I think at least in the short term, until we can vaccinate more and more people, we should continue to vaccinate as fast as possible, use our face masks and our face shields, and hopefully we can avoid a surge that is really devastating our ASEAN neighbors po. Thank you very much, Mr. President.
Thank you, sir.
Sir,
Dr. Duque.
thank you, sir. After Dr. Salvania, thank you, Dr. Salvania, for your presentation. Sir, if maybe allowed that we recognize Dr. Cynthia Saloma, the Executive Director of the Philippine Genome Center. You are recognized, Ma'am Saloma. Thank you, sir.
Good evening. Good evening po, Mr. President, of the members of the Cabinet. Can I have the first slide, please?
Welcome, ma'am.
So ngayon pong gabi, we are going to report to you our national genomic biosurveillance effort. If you remember, last December 26, you urged us to join the effort so that we can have a handle as to the number of the variants that are entering our countries. What is genome biosurveillance? I just would like to explain this po kasi maraming mga tao na akala nila point-of-care diagnostics yung genomic biosurveillance, no? So what is the purpose of our genomic biosurveillance effort? Number one is we track to how the virus is being, the presence in the country and how they are being transmitted in the community as well as po in our healthcare facilities. And of course, as part of our effort, we also detect outbreaks and we try to see what are the variants of concern that seems to be associated with these outbreaks. And of course, we identify the presence of new variants, both from our international incoming travelers, as well as, of course, we want to determine local transmission of these variants that come from our international travelers in cases where there are breaches in quarantine. And of course, we want to test whether the new variants change and how well our vaccines work. And of course, all these information will be very, very important to guide our response.
Sir, we will just have the third and last presentation before the cabinet members may want to ask, and Mr. President, they will be answering your questions, but perhaps it's best that we complete the presentation. One last presentation na lang po, maiksi lang po ito, kay Dr. Ana Ong Lim of the Technical Advisory Group. Mr. President, can we yield the floor to Dr. Ana Ong Lim?
Thank you, Secretary Duque, and good evening po, Mr. President, members of the Cabinet, and the rest of the IATF team. After listening to the presentations coming from Dr. Salvania and Dr. Saloma, I think the remaining question that we need to answer is what is the appropriate response now that the Delta variant has been detected within Philippine shores? So the first set of recommendations are actually focused on continued implementation of doors 1 and 2 of our 4-door strategy. So despite the data showing that there is already local transmission, border control continues to be a very critical component that we hope will continue to slow entry of more individuals who are positive, not just for Delta, but also other variants of concern that may be discovered in the future. Now, after completing the 10-day facility quarantine, the LGUs are enjoined to continue enforcing their monitoring of the arrivals for the remaining 4 days of the standard 14-day quarantine. Pag nakauwi, hindi po ibig sabihin na pwede na pong gumala yung ating traveler kasi hindi pa po tapos yung 14 days. 10 araw pa lang po yung inilagay nila sa facility. Also, it's very important for the LGUs to implement strict lockdowns in cities or provinces as necessary. Given the economic impact of imposing region-wide lockdowns, the response strategies anchored on imposing localized or granular lockdowns. And this will happen at the household or barangay levels. And with implemented targeted response strategies, we hope to be able to reduce transmission, at the same time also reduce the economic strain of actually implementing these lockdowns. Next slide, please. The second set of recommendations focuses on surveillance and improving our healthcare capacity. So our strategy to manage a possible surge is to ensure that the healthcare system is actually ready regardless of the community quarantine classification. Hindi po yung mag-escalate po tayo at saka palang naghahabol. Dapat parating ready ang ating healthcare capacity. There should be sufficient TTMF and ICU bed capacity. And as per IATF Resolution 104, we're calling on the hospitals to increase their COVID-19 bed capacity to 30% for the private hospitals and 50% for the public hospitals to ensure that should a surge happen, we will have enough beds available. So to summarize, my key messages po, Mr. President, are disease surveillance enhanced through whole genome sequencing will ensure that we will be able to detect our signals immediately and be able to keep one step ahead. Second, with the confirmation of the local transmission of the Delta variant, we need to work on the premise that every case that's now detected is Delta so that we can act accordingly. Next, each component of the 4-door strategy should already or is already in place and can still be intensified by continuing to implement our strict border control, not only at all airports, but also at seaports. We've seen that our initial detections actually happened among seafarers. We need to shorten case and close contact detection and immediately implement isolation and quarantine for these individuals. We need to fast track vaccination and focus particularly on A2 and A3. And as a last line of defense, we need to equip our hospitals by providing them with health human resources, with the appropriate equipment, with oxygen supply, and we will be able to maintain their capacity if we triage appropriately by providing enough TTMF facilities. Maraming salamat po.
Thank you, Doctora. Anybody from the panel who want to... Sunny?
Yeah, Mr. President, just to follow up on your statement and also the statement of one of the experts who said that vaccination is the top priority. We just want to assure the public that we have, for the first half of this year, received 20 million vaccines. Okay? Actually, by yesterday, we already received 30 million vaccines. We expect to receive around 65 million from July 1st until September 30. That's the third quarter. And around 55 million by the end of the third quarter. So the total we are expecting to receive this year is 171 million doses. So that 171 million is more than enough to vaccinate the entire adult population of the Philippines. And the money is already available for that. Okay, so there is no problem with the money for this year. Okay. Now, for next year, we just had a meeting with Secretary Abisado and Secretary Duque yesterday, and we noted that we have in the budget for next year already 45 billion pesos for additional vaccinations. Just to assure you yourself, Mr. President, and the health community, we do have the money for that. Now, the question is, how do we use that money? Are we going to need booster shots? Are we going to need another set of vaccinations? Whatever it is, please tell us so that we can properly allocate these funds. So, Mr. President, I don't think we're good only until 6 months. I think we are good beyond 2022. Okay, so it's nothing it is not going to be easy, but the moves that you have made from 2016 to 2019, we are ready to handle this problem financially. And that is due to you, Mr. President. So, again, to summarize, we will be, by the end of this year, we will be able to vaccinate the entire adult population of the Philippines. Hopefully, everybody will agree to be vaccinated. Number two, for next year, we already have 45 billion pesos in the budget and already financed for whatever the DOH is going to recommend, Mr. President.
Ang problema ko may isa pa. I've been hearing Senators Lacson, if I'm not mistaken, I forgot the other, Soto, that we are underspending sa bayanihan. Totoo ba ito? Is this true?
Yeah, Mr. President, according to the DBM, we have already released 660 billion pesos. Okay? 660 billion. What they are referring to as quote-unquote underspending is 6 billion pesos or 1% of the total. Now, we are, the Department of the Budget and ourselves are going to each department to see where the 6 billion is. But Mr. President, this is 1% problem. This is not, in relation to what we have released of 660 billion, this is 1%, okay? And we are sure that it will be released. But in the meantime, we are asking each department to really push the expense, to really spend the money.
The problem is, one thing very wrong with Congress is that they are not listening when you are talking. So, it would be better to give it a little shout. Yeah, totoo. Yung sa Bisaya, tira pasagad. Kung paski sa ano lang tatama. Tell them that 1%. Nakakaano kasi because the criticism is always on the executive department. Tayo yung execute sa law. So when we say that you are not spending the money correctly because there's underspending and it turns out it's only 1%, I'd like to tell Congress now that when Secretary Dominguez is talking to you, please listen. Walang ano yan. There's no malice in that statement, pero makinig kayo para hindi kayo din biyang Bisaya tira pasagad. Yung basta lang tatamaan yung buwan. So, is there any other guy in the panel who'd like to, Secretary Roque?
Thank you, Mayor. Tatanong ko lang po yung mga eksperto, no? Kasi ngayong meron ng local transmission na na-confirm ang Delta, nag-declare po tayo ng GCQ with heightened restrictions sa Metro Manila, sa apat pang mga probinsya. Tapos, kinancel na po natin yung naunang IATF resolution na po pwede nang lumabas ang mga bata. So, hindi na po sila uli po pwedeng lumabas. At saka nag-impose na po ang MMDA ng curfew na mas mahaba, 10 to 4, no?
Yes.
Juan Lopez. Yeah. Permission to talk?
Yes, go ahead.
Okay. Good evening, Mr. President, mga kasama. Actually, the way we are handling this right now, I believe that we were willing to sacrifice a bit yung ating yung economic mobility. by immediately doing this GCQ with heightened restrictions the moment it was reported to us na may dumami yung cases ng Delta variant. Kaya nga po about 2 days ago, from what we just enjoyed na GCQ, umatras ulit tayo sa GCQ with heightened restriction. But we appreciate also the good balancing act of the IATF with the help of the health expert na yung ating restriction nakafocus lang karamihan dito sa mga non-essential activities na binabawasan natin. Especially itong mga sinasabing super spreader events, bawal talaga at pinapahinto natin yung mga non-essential activities. But what is important, to the extent possible, we are allowing economic activities to continue. I think that is very important, Mr. President. Hindi naman natin pinasara lahat ng mga operations ng mga exporters, mga BPOs, mga manufacturing. Tuloy-tuloy po ito. And that is, I think, the balance that we are managing here, Mr. President. As long as they all follow minimum health protocol standards, ma-maintain natin, hopefully, itong momentum that we are enjoying right now na nakakabawi naman ang ating economy tulad po ng tinatanong nyo kanina, unti-unti na pong nakakabangon. At least with this quick reaction natin na magbalanse kaagad, umatras ng kaunti, para hindi umabot sa mas matagal or mas malalang situation tulad ng Delta variant sa ibang bansa, ay hopefully ma-maintain natin itong balance and to allow the economy to continue. At nakafocus yung opening sa economy, hindi po sa mga non-essential activities. So, yun po yung, I think, the observation that we're trying to emphasize right now. It's really finding that balance and close working relationship with the experts and the economic team, Mr. President.
Anybody else?
I will brief on the effects of southwest monsoon enhanced by tropical cyclone Fabian, as well as update on the volcano situation and earthquake early this morning is 6.7 magnitude earthquake with epicenter in Calatagan, Batangas. First, on the two hydrometeorological events that system that affected the archipelago. First is the southwest monsoon, which actually started way back in June and probably will extend up to sometime in October or November. And the southwest monsoon is bringing hurricanes to mostly the western part of the archipelago or western side of Luzon. And the other weather event is tropical cyclone Fabian, which is, although the track is way north of the archipelago, its location is somewhere between Taiwan and Japan. It is enhancing the southwest monsoon, thereby we are receiving more rains as than normal due to the southwest monsoon, resulting in flooding in several parts of Luzon. The next slide, please. This is the timeline for the development of Typhoon Fabian. It was detected by Pag-asa last 16 July as a low pressure area. It was developed into tropical depression, then tropical storm, then severe tropical storm, into typhoon ultimately last 20 July. And the transition is from its development as an LPA within the Philippine area of responsibility. It traveled generally northwest towards the direction of mainland China, passing through the seas between Japan and Taiwan. But again, it enhanced the southwest monsoon that affected our archipelago. Next slide, please. This is the weather outlook we received from Pag-asa for the next week. For Baguio, it will have rainy days up to Tuesday next week. And for Metro Manila, we expect to have fair weather starting tomorrow, Sunday. One city will still have some rainy days up to Wednesday next week. That's right. And here are the effects monitored from the southwest monsoon and tropical cyclone Fabian. The magnitude 6.7 earthquake in Calatagan occurred early this morning at about 4:49 in the morning. Its epicenter was in Calatagan, Batangas. Its highest intensity recorded was based on the PMOS earthquake. Its intensity scale is 5, which is categorized as strong. It affected 4 regions, mainly Region 3, Calabarzon, Mimaropa, and NCR. And we did not receive any major damage, only minor ones from Lubang, such as collapse of seawall and river wall, and damages to 2 houses. However, the local government units are still continuing conducting their damage assessment and needs analysis. Also, there was no recommendation for any intervention from the national government agencies and even from the regional government agencies. So this is my update as the President of the effects of Southwest Monsoon and Tropical Cyclone Fabian on the status of Taal volcano and the effects of that 6.7 magnitude earthquake in Calatagan early this morning. That's all, Mr. President.
Gusto ko lang malaman kay when will be the new classification sa quarantine be published or
Sir, may bago po tayong quarantine classification for NCR and 4 other provinces, Ilocos Sur, Ilocos Norte, Davao del Sur, and Davao de Oro, to GCQ with heightened restrictions beginning July 23 to 31st. We will meet next week, Mr. President, for the August 1 to 15 community quarantine classification. We will ask for your approval, sir.
Okay.
Thank you.
Yeah. Now, I'd like to ask Charlie this time. Secretary Galvez, the one thing that I have noticed sa tawag lang sa cellphone, those who can connect with me when I was in Davao, many local government units are desperately asking for additional bakuna. There's a strong upsurge of in places like Iloilo, Bacolod, Cagayan, Agusan. So kindly tell us what we should be doing to hinihingi nila ng bakuna nagpapadagdag nga Bacolod this one. The mayor there is asking for more. So when can we accommodate them with the sufficient vaccines at this time?
Sir, actually, sir, with the clamor of many LGUs, we assess that we need to increase our monthly delivery from 20 to 25, because we saw that there is really a great uptake already for many LGUs, and we saw that many provincial governors and also mayors are already prepared for the vaccination of their targeted individuals. I have some presentation, Mr. President, if you will allow me to present. Sir, as you can see in the picture, that our population is really ready. Most of them are even lining. Can you give the first slide? So as you can see in this picture, this is one of the picture that we saw that they're lining up. Even there are ibig sabihin natin, sir, nakikita natin rain or shine, day or night. Talagang wala pong let up yung delivery at administration ng ating mga vaccines.
Sir, may I cut you there? Actually, mukhang hindi tayo nagkulang sa bakuna. The problem is for the local governments to come up with a more sane process of vaccination than allowing people to queue as early as 4 o'clock in the morning and getting their shots at about 9 o'clock. It seems to be, to me, it's not the way to vaccinate people. Nakita ko yung kanina sa umaga. I was still awake. I was signing the documents of government. Nakita ko sa na yung iba. Well, itong mga media did always want to exploit news. And they were already talking about leptospirosis. Well, kasama yan. But yung cold, people are exposed in the open, unprotected from the elements, tapos waiting for get the chance to have this shot. Mga 3 to 4 hours magtindig dyan, sir. Sabagay, baha kasi ngayon eh. They could just have look for another auditorium there or somewhere to do it. Can I request the Secretary of Local Government to just enjoin them, maybe a directive to enjoin them to be more circumspect and not to, especially now that the southwest monsoon is passing the country. Na hindi ganito ang it's not the way how to do it. They have to be more proactive than just maybe setting a venue then without the mechanism of how to transfer it and at the same time informing the people of the new site. But itong ganito and waiting as early as 4 o'clock in the morning, tignan mo yung para mang to me it is not it's bullshit actually. Kapag ganon ang ginagawa mo sa Pilipino, if you cannot do it in a place where there is roof to cover their heads, na hindi sila mabasa, na not exposed to the elements, umagang-umaga, naku, Diyos ko po. Bakit naman ganun ang why can't they just look for another last minute? I said the other the end of the line is the government there. Na they should be flexible enough to immediately look for a place now which is dry and which can house so many people, and dividing them into groups and make a head count of how many they can, time and motion nila sa pagbakuna, how many they can inoculate, tapos pabalikin nila ng yung iba. rather than let them wait there. It's a question of common sense eh. Hindi na nila ginamit doon, hinati na sana nila, divided into half and telling the others to report for for their vaccines at another hour. And look for a place, I said, where people are protected from the elements of the climates. Kaawa naman. I would say that I would question the mayor and the barangay captain. Kaya nga dapat talaga yan sa barangay captain because it is the barangay captain who would act as the marshal. Marshal ba? Babantayan niya yung mga tao. It's the barangay captain there sa mga tao. Pero yung ganon, I may also overshoot my comments there. Dito ho, sinabi na basta open to everybody and anybody. Ang problema, yung crowding. People who would respond to the announcement that inoculation shall be given to those who are there on the site, but not taking into account, I said, the amount of time and emotion to do it and making them go back. You come back for at some other hour. And on top of that, really, the most important thing is to look for a dry place. Yan, sana tatama yan. Leptopyrosis, then you have the influenza, then you have the respiratory. Pag tinamaan pa yan ng pagka tinamaan niya ng simple cold, it can deteriorate into a respiratory problem. Pag sinakyan ng COVID, mapatay na. So, I'd like to have a rule, sir, that to encourage them to not to use that kind of setup. Even if it is numbered in the inoculation or it is just given to anybody who's there who wants it, it has to take into account the weather now and the place that where they should be waiting for. That ought not to be repeated, I suppose. Kawawa yung tao. Anybody else would want to? Del, you have something? Well, one thing going in our favor is really in other countries, they are having riots about the bakuna. In Indonesia, in some parts of sa France. But mabuti ito, we are better off because our citizens are really law-abiding citizens, and you can tell by the response of the people. We have yet to see a raucous there somewhere regarding the vaccination process. Wala tayong mga yun, nagra-riot yung iba eh. Dito, wala naghintay. Yun, nakakaawa yung the picture that you saw. That ought not to be repeated. I would task the Secretary of local government to, I don't know how he would do it, but find a solution to the problem. So, may papasalamat, utang na loob ko sa inyo na tinutulungan ninyo kami, lalo na yung mga experts, the doctors, our scientists, and the people who have, because we do not have enough time to see Secretary Lorenzana keeps on looking at his watch. Pa may dito sa peripheral. So, kung wala na, maraming salamat po sa inyo, and I hope that we can call upon you to this kind of, I know that it can be tiring, not boring. But I said there are some other entities of government who should be made aware of, so that they can make the preparations if things get really worse. Alam mo, you can set the date. You can propose, but it is God who disposes. So let us pray that the weather, the political weather, and the weather of climate change will be kind to us. Thank you very much. Good night.